the reason for this, for us to have incidences, that we record incidences of zoonosis, is that increasingly humans have been having more interactions with animals over time. Animals have a lot of benefits they provide for humans, such as food, fiber. They serve as educational tools for us. Like I was saying the other time, there are some surgical procedures that have to be performed in animal subjects before they are performed on human subjects. And they serve as companions for us, for those that keep pets in their houses. They serve as a source of livelihood for those into livestock, and so many things that have enhanced interactions between humans and animals. But what we have to know here is that there are so many germs that some of these animals carry. Germs like viruses, bacteria, fungi, and all that. And these pathogens, germs, that's what pathogens are called. They can hop from the animal host to the human host. So sometimes we have this cross-species interaction, and that is how we come by zoonotic diseases, okay? So as the name implies, and with the explanation I've given to it, simply put, zoonosis are diseases that come from animals and enter into the human body, and they can result in various forms of illnesses. You know, they can make you sick when you get infected with this pathogen. The sickness might range from mild illnesses to moderate to being severe. And sometimes zoonotic diseases can lead to death. And really, we should be concerned, because the question is, why this topic? Why do we have to discuss zoonosis? Why is it important for us to know about zoonotic diseases? Well, I will say that it is important that we get educated and we create awareness about zoonotic diseases, because most of these diseases have major epidemic potential. As a matter of fact, some of them move from being an epidemic disease, like from causing an epidemic to a pandemic. And that brings me to the next question, and I'll have you answer my question in the chat box. So, do you think the current COVID-19 is a zoonotic disease? So if you have the answer, or if you want to make a good guess, you can put the answer in the chat box. And I'm going to talk about that in a bit. So why should we care about zoonotic disease? Why should we discuss it? Why should we be educated? Apart from the epidemic potentials, zoonotic diseases, when it happens, like when individuals get infected, they come about infecting, or they go about infecting other humans, all right? And when this happens, it's even if it's in a particular region, just one region, it poses or constitutes a threat to global health security in terms of, you know, causing so much havoc in certain communities, and you know, with the transmission chain going on and on and on, you know, it just go round and round, and before you know it, everybody is affected by the disease. And another reason why we should be concerned and we should be talking about zoonotic diseases is that it causes huge, significant economic losses in terms of, you know, loss of livestock, loss of pets, loss of trade, tourism, and all that. Because you won't want to invest your money in livestock that, or in a country in which there's current breakout or outbreak of disease, right? You wouldn't want to do that. So it's usually results in significant losses to both the individuals and the government. And one more thing that is very important that I must mention here is that we have to discuss zoonosis and educate ourselves about zoonotic diseases because it causes, or rather creates so much burden to the healthcare systems of countries affected. So you can see, I can go on and on and on about reasons why we should educate ourselves about zoonotic diseases. And right now, what I would say is that we should all come together, like all hands have to be on deck to make sure that we curb anything that could facilitate the spread of diseases, especially from animals to humans, which would then result into human-to-human transmission of such disease. So we'll go on to talking about how these diseases are spread from animals to humans. Well, there are various means by which zoonotic diseases can spread. One of it is through direct contact. Yeah, when an individual gets in contact, close contact with the body fluids of an infected animal, like urine, blood, mucus, and all that. So the germ can actually get into the human body, can get into your body, and you come down with an illness. And the second mode of transmission could be indirect. Indirect in the sense that an individual might come in contact with a contaminated surface, object, you know, and the germ will have an entry point, will have a means of entry into. And, and sorry, are you talking to me? Is that the hope? I can hear some background noise there. Okay, so another means by which zoonotic diseases are transmitted from animals to humans through water and food. Through water and food in terms of consuming contaminated food materials, or for some people, they drink milk raw. There are some places whereby they drink raw milk, unpasteurized milk. You can get some of these germs into your body by consuming contaminated water and food. So for that, we call it foodborne and waterborne. And we also have vector-borne. So we could have the diseases being passed on to us by insects. There are some viruses that we call arbovirus. They are arthropod-borne viruses. Arthropods are insects. Yes, insects like mosquitoes. Yeah, they pass some of this virus. They serve as a vehicle, so to say, for this virus to get to us. So we've got to be very careful. And at this junction, I must mention that majority of us have this lackadaisical attitude when it comes to taking care of an environment. Yeah, as an environmental toxicologist in training, I would relate my lecture today's lecture, to the environment, because there's no way we could not talk about the environment when we talk about the outbreak of diseases. We should know that we don't live in isolation. Humans don't live in isolation. We've got a shared environment with animals and plants, with all living creatures, even with all creatures, with everything, both living and non-living. And that brings me to the topic of One Health. So the One Health initiative is something that we need to discuss. It's something we've got to educate ourselves about. So there's been so much talk about One Health, One Health, One Health. It's not something new. It's something that has been on for quite some time. But with the recent outbreak of the COVID-19, there has been renewed talks about the One Health approach. And basically, what is the One Health approach, you would ask? The One Health approach recognizes the fact that humans don't live in isolation. They live and interact in very close contact with animals, plants in our shared environment. So if we want to achieve good human health, like we want humans to be in good health status, then that means we have to take care of animal health and our environment. We've got to have a healthy environment as well. So this, the importance of having a clean environment, okay, cannot be overemphasized with factors affecting us, such as climate change, environment and all that, land use, degradation, and all of that. It makes it easier for for us to witness outbreak of diseases and for these diseases to spread. And as I was saying, when I was talking about the vector-borne diseases, like the vector mode of transmission, take for instance mosquitoes. From our whole region of the world, in West Africa, Nigeria to be precise, we don't really see mosquitoes as anything. As a matter of fact, we see it as being so common that we don't feel alarmed when we have mosquito infestations in our homes. As a matter of fact, not until when the population of mosquitoes in the house becomes increasingly annoying, like unbearable, before some of us does something about it. And the same goes for rodents too. Rodents such as mice, rats. We don't really see anything wrong in seeing one or two rats running here and there. We see it as the norm. But the fact is that this set of animals, they can serve as vehicle for germs entering into your body. Mosquitoes in some parts of the world, fine, malaria is endemic in Nigeria, like it's common, and people recover from heat. You know, you go to the hospital, the doctor writes out anti-malaria drugs for you, and after taking it for days, at most 3 days, 4 days, or 5 days, you get better, you feel better. But there are some places where mosquitoes carry more deadly viruses that whose effects, aftermath effects, can be quite devastating. For instance, one that really comes to my mind is the ZIKA virus. The ZIKA virus is a virus whose mode of transmission needs mosquitoes, okay? The mosquito would carry the virus and bite an individual. When you get the mosquito bite, the virus is transmitted into your bloodstream. For Zika virus, most people recover within few days to, about a week. They get better and all that. But what is of most concern is pregnant women or women that are intending to get pregnant. Because what this virus does is that it finds its way through the placenta into the uterus, into the womb, and infects the baby. And when it does that, it can result into various birth defects for the baby. And you can see, the reason why I brought this in particular is that we see mosquitoes as something that's not so threatening, like something so little, something that we can easily wave off, by just waving our hand and all that and dismiss. We need to take care of our environment, because when you have a puddle of water, you've got stagnated water somewhere, of course it's going to attract mosquitoes. when you look at our environment, the gutters, for instance, you see people pee in the gutter, they urinate in the gutters. Even some market women, sorry for saying that, not just market women, you see people, they clean the buttocks of the baby after defecating, after the baby has passed out feces. They just take water and clean the buttocks of the baby, the feces into the gutter. So all these things are going into the environment. All right. And of course, so many things will be bred, so many things will come as an aftermath of that. So we have to be cognizant of our actions, the aftermath of our actions, and we had better be prepared to live with the consequences of some of our choices. And that is why forums like this is important. Opportunities whereby we can come together, discuss issues like this, and get ourselves educated on how to make informed choices. So how can we protect ourselves and our family from zoonotic diseases, from being infected by some of these pathogens? Like I said, pathogens are germs, viruses, bacteria, fungi, parasites, and all that. One very important way we can do that is by limiting our contact with animals. Yeah, we can find, like I said, some of us, we use animals as a source of livelihood for us. They serve as a source of income. So there's no way we wouldn't go to the farm. For farmers, livestock farmers amongst us, for poultry farmers, of course, you need to interact with your birds. You need to give them food. You need to give them water and all that. But as much as possible, limit your interaction with animals. And as for some of us that keep animals as pets, alhamdulillah that we are Muslims. And I would say that I used to marvel at how beautiful the religion of Islam is. Why? Islam has told us specifically that we should not keep some certain categories of animals as pets, right? Animals such as dogs, you don't keep as pets. You can use them for security purposes. You can use them for hunting and for some other purposes, right? Islam has also made us know that you don't keep wild animals as pets. And these are for very good reasons. Because by the time you marry science with religion, you know, you come out with a very beautiful piece, and you see the logic, you see the reasoning, you see the beauty of the religion. Because science have come to find out that there are some diseases that you get mainly from wild animals. And I will still talk about the issue of pork, which is pig meat. Islam has also said that we should desist from eating pork, pig meat, right? There are so many diseases that pig transmit. What they do, what happens is that the pig serves as an intermediate for a whole range of diseases. And by the time I start mentioning them, you would be surprised, and you keep on saying alhamdulillah that I'm a Muslim. So it's always good when our scholars talk to us about the do's and don'ts, the halal and the haram things, for us to stick with the halal and persist from engaging in the haram thing. Because at the end of the day, we find out that it's for our own good. At the end of the day, we find out that what has been written thousands of years in the Holy Quran, the scientists will now come out with certain findings from research work telling you that, oh, we discovered that this is good, this is bad. Meanwhile, it has been written in the Holy Book thousands and thousands of years ago. So, this is the light I'm a Muslim. So, as I was saying, we should limit our contact as much as possible with animals, not until when it is absolutely necessary for us to interact with them, that we should interact. So what other means can we prevent ourselves or protect ourselves and our families contracting zoonotic diseases. Another is by practicing constant hand washing. Yes, with the advent of the current pandemic, the COVID-19 pandemic, I'm sure that is no news. It's not strange for you to hear over the radio, when you browse the internet and when healthcare providers, they tell you that you need to practice social distancing and to wash your hands very well, and for good reasons. When you wash your hand, you should wash it with soap and water. As a matter of fact, I get amused when you come across people in the restroom. When they go to the restroom, they just finish from the toilets, and they turn on the faucet, run the tap, just do a little push, push, and go out. And I'm sure if you have caught such people, if you ask them, they will say, "Oh, I washed my hands after using the restroom." There's an appropriate technique, an appropriate way for you to wash your hands. Some will throw their heads back and laugh and be like, "I'm only boy you want to date. They've come with it again." What do they mean by appropriate way or appropriate technique of hand washing? When you wash your hands, you need to put soap. You need to use soap. It could be any toilet soap, any bar soap. It doesn't necessarily have to be antibacterial soap for it to help you get rid of germs, okay? Let's be clear on that. So you have to put soap on your hand, put water, and rub your palms together. Wash the back of your hands, wash in between your fingers and underneath your nails. I don't keep long nails, okay? But you'll be surprised when we put samples, or when any of us put our hands under the microscope, you'll be surprised at the number of germs that your fingernails contain. So even if you don't keep long nails, and for good reasons, that's why I say Islam is so beautiful. There are etiquettes in Islam. Every Friday, we've been encouraged to, cut our fingernails, have the ghusl bath before going to Juma and all that. So Islam is so beautiful. It's so perfect. It's all encompassing. And I can't thank Allah enough for making me a Muslim. So like I was saying, you need to wash your in between your fingers and your fingernails, okay? For you to be able to get rid of those germs. So the proportion of time you do this is about the time you sing a happy birthday song to yourself, like 20 to 30 seconds. So it is very important we put our minds there. We have to make a conscious effort, not just putting our hands on that running tap for a second and we're off. We need to practice constant hand washing and do it the proper way. Another way you can prevent the spread of the disease is by supervising your kids when they are around animals. Children are very playful. They are very carefree, and really they're so innocent. They might end up hugging the animal, they might end up petting it, kissing it. As a matter of fact, in this part of the world, in the Western world, abroad, they've got zoos called petting zoos. Yes, you heard me right. Petting zoos. Petting zoos, I think in some places they are called children's zoos. In such zoos, you go there, they don't keep wild animals usually in such zoos. They keep docile animals there, in which you can move close, you can have close contact with such animals, you can pet them, you can touch them, rub their body. Even feeding is allowed in such zoos. Yeah, you can feed the animals and all that. So, and really, there are advantages and disadvantages in such places that you can have the experience of taking care of an animal, but at the same time, you stand the risk of contacting a disease or picking up certain types of germs from such places. So when your children are around animals, try as much as possible to supervise them. And in a scenario whereby water and soap is not available for you to use for washing of your hands, it is recommended that you use hand sanitizers. Hand sanitizers that contain at least 60% of alcohol. That should do the job. But I will have you know, please keep at the back of your mind, hand sanitizers do not completely get rid of all germs. I will repeat that. Hand sanitizers do not completely get rid of all germs. So as soon as you can, as soon as it is available, get water and soap and wash your hands. All right. So those are the means, ways by which you can basically protect yourself and family from the spread of zoonotic diseases. And please, the environment, like I said, as an environmental toxicologist, I'll be relating my talk to the environment. You need to keep your environment clean. Because let's take a look at this. There's usually an association and causal effect in this. Association in terms of having a particular thing associated with our surrounding, and that thing is affecting us. And the causal effect is that, oh, as a result of the intensity of what is around us, we are suffering the consequences, that is the effect. So there's no way you can have a dirty environment and you won't expect to have an outbreak of disease. But by keeping a pristine environment, a very clean environment, but of course, you at least rest assured that you won't be having surprises every now and then. All right. So who are those that are at high risk of contracting zoonotic diseases? Well, I would say everybody is at risk of getting infected by a zoonotic disease. But those that are at higher risk are usually those that have a compromised immune system, compromised in terms of weakened immune system and all that, or they have pre-existing medical health conditions. And for this group also, pregnant women would fall into this group. So they have to, if you're pregnant, you have to be careful with what you do, the environment you stay in, and how you interact or come in close contact with animals. And those that have a high risk of contracting zoonotic diseases are children below the ages or below the age of 5. Let me put it that way. They have higher risks of contracting zoonotic disease, and also adults above age 65. All right. So this group of people should take better care when it comes to interacting with animals and, going about the day-to-day activity. So we will go on to talking about how we should, or probably we should go into giving examples of what some of these zoonotic diseases are and how they affect us. And before I go into the PowerPoint presentation that is showing you my slides, I asked the question about the COVID-19, which I asked people to respond by typing in the chat box. But so far, so good. I've seen just one answer to that question. And the question, for those that joined rather late, or for those that didn't hear the question is, do you think the current COVID-19 is a zoonotic disease? Yes or no? So I will still give little time for you to answer that question and talk about cats. I had promised myself that I was going to talk about cats because, believe me, I am I'm a lover of cats. I'm a very great fan of cats. I love cats. I can remember when we were little, very, very little, before we got to high school, we used to have cats in our house. I come from a rather large family, a big family, and they had close to like, is it 5 or 6 cats as at that time? They were very cute cats. Cats are very elegant creatures, very elegant, very cute, and they are naturally neat, naturally clean. All you need to do when you have a cat as a pet at home is that you need to get them a litter box, get them a sandbox. Unlike dogs, goats, chickens that poo on the floor, you just see droppings here and there, all over the place. Once you provide a litter box for your cat, whenever they feel the need to defecate, to pass out feces, they just go to their litter box, they go to their sandbox and do it there and clean it up. And as a matter of fact, they are so clean that they lick their body at intervals. Yes, they lick their bodies, just to make themselves clean. So I'm actually a sucker for cats. But the reason why I need to talk about cats is that for pregnant women, once more, there are some pathogens, that is germs, that the cat species serve as an intermediate host for. One of it is Toxoplasma gondii. Toxoplasma gondii is the causative organism for toxoplasmosis. Sorry, all this seems like big grammar, but I'm going to break it down. So toxoplasmosis really is an infection that comes into the human body by contaminated food material. It could be water too, and it could be through bites or scratches. So if you are the type, and I'm the lie, I don't think there's a restriction in Islam that says we can't keep pets and we can't keep cats as pets in our houses. And that is why I'm bringing this up, because I'm talking to at least majority of us. Alhamdulillah, I don't think there's a non-Muslim here. So, but I know I'm talking to a Muslim audience. So my listeners are Muslim. So some of us might be keeping cats at home. So for pregnant women or women that are intending to get pregnant, please don't, basically for pregnant women, don't clean out the litter of your cat. Don't clean out the litter box or dispose the sand box yourself. The reason for this is that if your cat is infected with the virus, carries the virus, you might not know. Why? So many of these pathogens live on animals, and these animals don't appear sick. They don't. But these are pathogens, germs that can potentially cause harm, a lot of sickness for humans. Like I said, they cause a whole range of illnesses that might, range from being mild to moderate to being severe. So if you are a cat lover and you've got a cat at home, or even for stray cats, not just those that keep cats as pets at home. So even if you don't keep cats as pets, stay away from stray cats if you're pregnant. If you, in the course of cleaning, like as I was saying, in the course of cleaning the cat litter, the virus may become aerosolized in terms of it may get dispersed, spread into the hair. Then you inhale it in. When you inhale it, what happens is that the virus finds its way through the placenta, similar to what I described in the case of Zika virus. The parasites, I think I've been using virus for toxoplasmosis. No, it's a parasite. It's a parasitic infection, not a virus. So pardon me for that. So what the parasite does is that it finds its way, it travels and finds its way through the placenta into the uterus, that is the womb, and affects the baby. And the baby has a risk of being born with a condition known as hydrocephalus. And hydrocephalus is not something you would want for your child. It's not a condition you would love to see. It could be quite devastating. It's not so good. As a matter of fact, that is even if it's a live birth. That is, if you don't end up having a stillbirth, because the parasite has been known to cause abortions, okay, in pregnant women. So please, there's so many of this that we can bring as examples. but then we just need to like limit our talk to a few selected ones. And so, okay, so I can see a response to my question. So now I have two answers. All right, so Galaxy A50 says yes, COVID-19, likely zoonotic. And Damilola Oyewole, is that Oyewole, says yes. All right, so alhamdulillah, thumbs up for both people. Alhamdulillah, yes. Studies so far have suggested that, okay, from Islamia Adebowale as well. She says yes, alhamdulillah. Thank you for that. So alhamdulillah, we've got very intelligent and learned people amongst us. So I like those answers. So yes, COVID-19, from studies, from research that has been carried out so far, says that there has been evidences that are linking the COVID-19 to a zoonotic source. All right, but right now, because the coronavirus, the COVID-19, is still a new development, it's an emerging thing, emerging situation. We still don't know for sure what the source, the specific sources, but from research and scientific findings, they've discovered that the virus, which is the SARS-CoV-2 that causes the COVID-19, is closely linked to that found in bats. I hope we understand that. So now, what the issue is right now is that there's been various conversations, various discussions on how well humans interact or how far humans can go with interacting with bats. We don't usually come into close contact with bats, right? And from where the outbreak first got out, which is in China, Wuhan, it's reported to have been from a live animal market. Live animal market means that it's a market in which live animals are sold. You can get a whole range of animals like pangolin, you know, from getting domestic animals to wild animals. They sell all sorts there in that particular market. But the issue is that because there is little contact, day-to-day contact between humans and bats, they're still trying to say, the theory right now is that there should be an intermediate host. The scientists are thinking that there is a form of other animal species, another type of animal from which the virus transmitted to humans. That is, it literally could have hopped from the bat to that intermediate host. It could be a wild animal or some other form of domestic animal. That is what we don't know right now before it got to the human body. But there's this similarity, very great similarity between the SARS-CoV-2, which causes the COVID-19, to that seen in the bats, the virus seen in bats. So yes, there is evidence of zoonotic source for the COVID-19. So you can see we have to be very careful here. Like I said, like when I asked the question, why should we talk about this? Why should we be concerned about zoonotic diseases? If you can remember, one of the answers I gave then during the course of my talk is that zoonotic diseases have epidemic potential. And when they spread, epidemic, yeah, let me break that down too, because this is not a medical class, so or an epidemiology class. So epidemic means, how am I going to put it now? The spread of, or the occurrence of an infectious disease from in a particular region, widespread. Yes, it has to be widespread for you to categorize the disease or the condition as being epidemic reaching epidemic proportion. So it's basically, when you talk about epidemic, it's the occurrence of the widespread occurrence of infectious disease in a particular community, or it could be a particular region at a particular time. So it's something that affects a large number of people at the same time. So, and when we talk about pandemic, so let's make a distinction here. What's the difference between epidemic and pandemic? For pandemic, we could define that as the incidence of an infectious disease across large geographic areas. Yes, large geographic areas in terms of a pandemic would cross from one country to country. It crosses borders. It affects a whole lot of countries at the same time, like the situation we find ourselves in presently with the COVID-19. So for pandemic, it crosses borders, it moves from countries to countries, it moves across continents. So, and when this happens, you know, the result, the aftermath effect is usually very devastating because it causes a lot of burden on the healthcare system, and it poses or constitutes a threat to global health security, and it results in significant economic losses. And before some countries recover from these economic losses, it takes quite a while. Like you can see with the advent of the present COVID-19, so many people have lost their jobs, you know, businesses are closed, and even schools are closed as well. It's affecting everybody across all walks of life, you know, all parastatals are being affected. Everybody nobody is spared at this time. And the reason why I will go back to the issue of One Health, I have actually defined what the One Health initiative is. And I told you that the One Health approach recognizes that for us to have pristine health, to achieve public health, that we won't be experiencing or won't have to deal with issues that would make us run helter-skelter. We have to take care of animal health, plant, and our shared environment. So that's basically what One Health is about. And I also emphasize the fact that it's not just a job for an individual. You don't just leave it to the government. The government cannot do everything. It has to take everybody. All hands have to be on board, you know, to achieve this. Both the human health medics, the veterinarians, the paramedics, the ecologists, the epidemiologists, and, you know, everybody has to be involved in order for us to have better health outcomes, all right? Better health outcomes for humans, animals, and our shared environment. So like I said, there is a PowerPoint presentation I would like to share with us. Let's see, but because I've been having internet issues with my laptop, I don't know why it's acting up this way. I'm so surprised that I wasn't able to present with the laptop this morning. It's a situation I least expected, but then I hope I'll be able to display these slides to you. So right now I'm going to shift from my phone to my laptop, and I hope that I will be able to share the screen with you so we can talk about examples, and you can see some examples of zoonotic diseases and what resultant effects. Okay. Maybe I'll have to switch devices now. I have to like go for Can everyone hear me? I've been talking, but it seems you can't hear me.
We can hear you now.
Oh, thank you. Because I've been talking, but it seems you've not been hearing what I've been saying.
Yes, yes. I think you just put on your mic.
Okay. All right, because I switched devices. All right. So now for this, we're going to go to the examples, showing examples of some zoonotic diseases. Please, I hope you can still hear me. Hello?
Hello, we can hear you. We can hear you.
Okay. So the first one we're going to be talking about is the rabies. Okay. There's no way we're going to talk about zoonotic diseases without talking about rabies, because it's one of the most devastating zoonotic diseases around. And what is this mode of transmission? The virus is transmitted by the bite of dogs or a rabid cat. And the natural host for rabies is the bat, all right? But you don't need to be bitten by bats before you come down with the disease, all right? You can get rabies from being bitten by a rabid dog or a rabid cat. Although the chances of getting rabies from cats is way less, about 7% or thereabouts. But then the possibility still exists, okay? So we need to be careful. And what signs do we see? Like we need to know the signs, the telltale signs, to make us suspect that a dog or an animal has rabies. So we can stay clear, or we can stay clear from such animal. One of it is that the animal would have paralysis of the jaw, which will affect the way it backs. And you can see from this picture, from this image, there will be foaming from the mouth. So, and the animal, you see the dog behaving so strangely. The dog will be behaving abnormally. There's incoordination, there's staggering. The dog will be walking in a wobbly fashion, will not walk in a straight line. And also the dog might be charging. It will be excessively aggressive and will be charging at flying objects and all that. And sudden death might ensue, it might occur. But
by the time you start seeing some of these signs I've mentioned, you should be wary and have a high suspicion index for rabies, that this dog might be suffering from rabies. And if you're a pet owner, if you keep dogs for whatever purpose, either for companionship or for security purpose or for hunting purpose, please make sure that the vaccination record of your animal is up to date. We can't overemphasize the fact. You see a veterinary doctor who is going to help draw out a vaccination regimen for your animal. So, and it's not just dogs that you vaccinate. You can take your cats there too. You can, if you're a farm owner and you're into livestock, since it's a form of income for you, you won't want to risk the chance of losing your entire investment, right? So please ensure that you have a qualified veterinarian that takes care of your animals for you. So for the rabies in humans, the signs and symptoms, if you get bitten by a rabid dog, the signs and symptoms are more or less similar to that seen in dogs. You know, your vocalization changes, the person practically becomes a walking zombie. There's bad breath, wobbling gait, and you know, there's paralysis of the legs and some other parts of the body. The person becomes increasingly aggressive. But before it gets to that point, the very first thing you notice is fever. So I would say this, that you don't need to wait to start experiencing some of these signs and symptoms before you seek medical help. I will repeat that. Do not wait until you start exhibiting some of the signs and symptoms before you seek medical help. The reason for this is that once you start exhibiting some of the signs and symptoms, it means that the virus had already migrated. It is advanced already. It has already gotten to the brain. And once it does that, once you start exhibiting, showing the symptoms of rabies, then the aftermath effect is usually fatal. Like there's hardly anything anybody can do for you to help you. And I would still want to educate us on what to do when we get bitten by a dog, because we should be able to know the actions to take when we do get bitten by a dog. When that happens, what you should do is that immediately get soap and water and wash the site of the bite, all right? Wash it thoroughly with soap and water, running water for about 15 minutes. And in an event that the site is bleeding, depending on the site, if it's bleeding, get a clean cloth and apply pressure to the site in order to either reduce or completely stop the bleeding. Then you can get an antiseptic liquid. Antiseptic, we all know what antiseptic is, right? Like Dettol, Savlon and all that. Any antiseptic solution will do. Use it to disinfect the site. After which you can put a bandage, but if you don't have a bandage, you can tie it up with a clean cloth. If you don't, no problem. But what you should do next is immediately seek the help of a medical healthcare provider, your healthcare provider. Seek medical help. It is very important. Just let the doctor be the one to decide if you will be requiring, if you will be needing the post-bite injection, because there's what we call the PEP, that is the post-exposure prophylaxis. It's going to help, you know, prevent the virus from spreading in your body or causing any form of illness for you. And usually, let me just say this too, what the virus does is that from the site of bite, okay, from the site of entry, it moves, it just looks away, because what it does basically is to attack the CNS, that is the central nervous system. It just looks for a way to travel through your body to the brain. And once it gets to that point, when it gets to the brain, that is when you start exhibiting the signs and symptoms. And if you can remember what I said, that it usually results into fatality, like there's nothing anybody can do for you at that point. And that's between that period of exposure and the period where you start exhibiting the signs and symptoms. It can range from days to weeks to even months. So you've got no excuse not to go seek the help of a healthcare professional when you find yourself in this situation, when you get bitten and all of that. So this period of incubation is what it takes the virus to travel from the source of exposure to your brain. And please, let's not wait for this to happen before we seek medical help. Right here is a picture of a man who has rabies. You can see that he's being tied up. Why? Because there's so much hallucination that is associated with the condition, aggressive behavior, and stuff like that. So we need to be careful, very careful. And like I said, we can get this from a rabid cat soon, but the chances are low. So we move on to the next slide. This is toxoplasmosis. Like I told you the other time when I was talking about cats, like I said, I'm a lover of cats, but we need to be careful with our interaction with cats or animals. This is an image showing you a lady, a pregnant lady, handling cat litter, and after doing that, she has gone on to eat the sandwich. So it's possible that the pathogen from the litter, from the cat's feces, could have contaminated her hands. But she from some reason, she didn't wash her hands properly before touching her food. She could get infected, and the virus could find its way through the placenta to the baby. And we can see there are a whole lot of intermediate hosts that could spread the pathogen. You can see the picture of the cat here. You can see poultry, birds here. You can see livestock, sheep, goats, cow, and you can see pig. I made mention of pig the other time, and also rodents. Rodents are mice, rats, and all that. So they all can contribute in the spread of this zoonotic disease. And the resultant effect of this parasite, that is the Toxoplasma gondii, that causes toxoplasmosis, is that the baby could be born with a condition known as hydrocephalus. This is congenital toxoplasmosis. This is congenital toxoplasmosis, in which the baby is born with a very big head. As you can see in both images, both the one on the right and on the left, the baby has a very big head. This is as a result of the fluid, excess fluid that is in the brain. So that is basically what hydrocephalus is. Hydro, water, right? Cephalus, brain, right? So naturally, like normally, the ventricles in the brain contains fluid. The spinal cord too, that runs down your back, contains fluid, that is the cerebrospinal fluid. But in this condition, congenital condition, you find out that there's excess fluid in the brain. And what happens at the end of the day is that the child might experience seizures, blindness, the child might be blind, the child might be mentally retarded, and a whole other things can result as an aftermath. So you can see the reason why we've got to be careful here, and we've got to take zoonotic disease as being very important. All right. And what the doctor usually do is that this condition requires surgical intervention. What the surgeon does is to perform a brain surgery, and by doing that, the surgeon is going to place what is known as a shunt into the baby that will drain the excess fluid from the ventricles into the abdominal cavity. But usually the postoperative results for some of these procedures is not so encouraging. So we're going to move to the next slide. So the third example of a zoonotic disease is the Zika virus syndrome, okay, caused by the Zika virus. Like I told you, we tend to overlook the mosquito infestation in our home so much. But there are a whole lot of pathogens, that is germs, mosquitoes could carry. The one we are so conversant with in our part of the world in Nigeria is the Plasmodium parasite, right? That causes the malaria, that gives us the malaria. The female Anopheles mosquitoes carries the Plasmodium parasite, and because it feeds on blood milk, that is your blood, while feeding, it can transmit the parasite into your bloodstream, into your system. So, but at the same time, like the Plasmodium parasite, it could carry some other pathogens, some other germs. Zika virus is one of it. The yellow fever virus is another. We've got a whole range of viruses that the mosquito could actually transmit. So it's no joke. It's no joke when they tell you to take care of your environment and for us to be wary about getting infected. All right. So like I said, the mode of transmission for the Zika virus is the mosquito. And you can see in this picture right over here, I don't know if you can see it clearly. We can see that this is a normal baby, a normal child, but in an event that the mother is infected with Zika virus, the virus can find its way through the placenta to the uterus, the womb, and infect the baby. So the baby might be born with a condition known as congenital Zika syndrome, in which you find out that the baby was born with an abnormally small head. Let me give you a better depiction of that. Okay, yes, I've got this on the next slide. And you can see the image on the right. You can see the first picture, that is of a normal baby. And usually for mothers, those that have given birth to children, you would agree with me that when you go for the first day your baby is born, they measure the baby's head. Before you leave the hospital, they probably did the same thing too. Then sometimes when you go for postnatal, you see that they measure the baby's head. So it depends on the healthcare professional, your healthcare professional. But the reason why they do this is just to know if your baby's head is growing in the right proportion, if everything is okay. Because for this condition, the best chances of the treatment for this condition, for working, for being a success, is for it to be detected early. And that is just about it. So the second picture here, the baby has microcephaly as the result of Zika virus infection. And the third picture is depicting a severe form of microcephaly. And you can see all of these A, B, C to J are live pictures of real babies that have this syndrome. So the baby will be born with partially collapsed skull, You can see, imagine your baby, God forbid, being born with a partially collapsed skull as a result of mosquito bite. Like I said at the beginning of this lecture, Zika virus is not so common in our home part of the world, but in some other parts like the North Americas and this Southeast Asia, Southeast Asia, it's endemic in such regions. So we need to be careful and get proper advice from our medical health professionals before we travel to such regions. So the baby has difficulty with seeing. The baby's brain would not develop normally the way it should, and it goes on and on and on like that. The movement of the baby will be restricted, or we're having problem with the limbs, problem with feeding. Breathing difficulty is associated with this condition. So let's move on to the next slide. So the next slide is talking about bovine tuberculosis. All right. So bovine, anything bovine. When you hear the word bovine, we're talking basically about cows. Yes. Let me just put it that way. There's no need for me to give example of some others. So there are some diseases too that we can get from cows. All right. Not just by interacting with them, but by also consuming them. All right. And that is why we can't overemphasize the importance of veterinarians and veterinary healthcare professionals in our community. They are doing such a marvelous work. It's just a pity that in Nigeria and some other parts of Africa, on the African continent, we don't value our veterinarians. Like we see them, we don't really know their importance. They do all they can to keep us healthy in terms of ensuring animal health. Because if there are no veterinarians, of course, you won't be able to get adequate health care or vaccinations for your animals. And when these animals come down with diseases and you consume them, of course, you get infected and you come down with the disease as well. So it's very important that we work closely with veterinarians, especially if we are into livestock production, all right? And if we own pets as well, then if you see stray animals, and this has to do with the government now, they need to have a mechanism in place in which they can take care of stray dogs, stray animals, and all that, so they won't end up spreading diseases to us. So for the bovine TB, in 2018, it was discovered that it caused well over 12,000 deaths, and over 140 cases were recorded in that same year. So I'm going to show you an image. Okay, so this is an image of how the TB looks like in various parts of the body. These parts are not human bodies, by the way, or human parts. It's animal parts. So you can see this is the rib side, the chest region. You can see the ribs, the rib cage. You can see all of these things that you see that looks roundish are called nodules. Okay, those are the TB nodules. This is the liver. This is the muscle. This is the lung. And now, at this junction, I must mention that there are some people who basically go to the market, because I remember when we were still in medical school, when we were still in vet school in the University of Ibadan, and we go on rotations, clinical rotations and all that, and we are posted to the abattoir, okay, for inspection and all that. There are some women that come to the market, that come to the abattoir to request for, listen to this, they request for fuku, olegusi. So I don't know if that rings a bell to us. They call it fuku, olegusi. Olegusi that they are talking about, they are referring to these noodles, all of this. So, like, not in my widest imagination prior to that time would I have thought that some people would go to the market to buy diseased parts. For some, like, they feel, well, after making inquiries, I got to know that for some, they see it as a delicacy, that when you eat it, that there's this feel that you get. And that's another pointer. That should be a red flag for you. And I must mention it here. When you are eating meat, maybe liver, any part of the liver, or even the lungs and fuku, and you hear this sound like sand grinding. This grinding sound, it's not really stony. The stony part, of course, will be in the muzzle, in the meat itself. But when you eat it, it sounds, you know, that kind of sound. I don't know if my video is on, but then I guess you can depict what I'm trying to say from all of this. So you hear the, please, that should be a red flag that that part you're eating contains noodles, and that could be a pointer to a diseased animal that has been slaughtered and sold on the market. And the veterinarians are working 24/7 to ensure that there's proper meat inspection. There's after the proper meat inspection, after adequate meat inspection, before these parts are sold for human consumption, before they are passed as being fit for human consumption. So we have to be very careful here. And if you go to canteens too, and they sell to you meat or parts, whereby you are experiencing this stoning or sandy feel after eating the meat, please spit it out immediately and call the attention of the owner of the restaurant to it. It could be very devastating because TB in humans can affect any part of the body as well. It could be pulmonary TB, which is very common. So pulmonary tuberculosis is the one that affects your lungs. And the signs and symptoms of that could include fever, weight loss, night sweat, coughing. As a matter of fact, in advanced cases, in severe cases, it could involve coughing out blood. So it's not a good thing. And maybe I should mention here too that for HIV/AIDS patients, TB constitutes one of the major killers of HIV/AIDS patients. Why? It's not the HIV/AIDS that kills you exactly. What the HIV/AIDS does is that it makes your body, the HIV/AIDS makes your body susceptible to opportunistic infections, all right? That is, it weakens your immune system. So opportunistic infections like this TB comes in, and that is what actually ends up killing the person. So we move on to the next slide. Okay, so this is talking about avian influenza. Avian influenza is another virus, like the H5N1 virus is another virus which has pandemic potentials. And during the course of our discussion, I've told you or described, giving you a definition of what a pandemic is. So this is another virus that has pandemic potential. As a matter of fact, in the year 1918, it killed more than 500,000 people. That is huge. People were literally dropping dead on the streets. So we can see that we can't overemphasize the fact that everybody has to be educated and all hands have to be on board to fight the advent of zoonotic diseases. And that still includes the One Health approach I told you about, okay? And that involves taking care of animals and taking care of our environment. So you can see here, pig is also an intermediate host in this. It can serve as an intermediate host for the virus. So please take care of pig. Another infection pigs transmit is the cysticercosis. So I must mention that Simply put, that is tapeworm infection. And that one, that's on its own too, could be devastating in terms of, you know, when the parasite moves from your gut, that is from your intestine, it looks for a way to travel to your brain. I don't know why most of them have this affinity for your brain. They go to the brain region and cause and havoc there and havoc. So please stay clear from pigs. So this is what your lungs look like when it's infected with the H5N1 virus. And we can see that the hosts, the intermediate hosts, are the birds. It could be wild birds, domesticated birds, and all that. Those are the animals you can get the infection from. So for the next slide, okay, I think this should be my last slide because of time. It's the ringworm infection, which we call dermatophytosis. I specifically looked up this slide and brought it up because the infection is so common and we don't really give it a second thought. Like, we don't really think animals could give us ringworm. If you can see from this image, starting from my left, the mice here, you can see the body, you can see the head, it's already losing hair, right? Then you can see the second image here too as well. On the dog, the infection on the dog, you can see that ring-like shape. Then the last image here as well, the third image. Then unlike what the name implies, ringworm infection, it's not caused by a worm. It's actually a fungal infection. And the reason why they call it ringworm, or why it has that ring in its name, is just because of the pattern in which the lesion comes. It comes in a circular pattern. For us to understand better, maybe I should show the next slide. Like I said, this should be my last slide because of time. So we can go to the question and answer segment. So this is how the infection looks like in humans. I guess most of us can relate with this slide, the images, especially mothers. For the last 2 or 3 images, we can relate to that, right? We can see the shape of the infection on the boy's head, both on the left and on the right. So this is called tinea capitis when it infects the scalp. Tinea pedis, tinea capitis, yes, when it infects the scalp. Tinea pedis when it affects the feet, and tinea corporis when it affects any other part of the body. Okay, that of the fingernail infection is called onychomycosis, and that is always so recalcitrant, as in it's always so hard to treat. But for these conditions, you can easily get an over-the-counter antifungal lotion or ointment, okay, to treat these conditions. It doesn't, usually they are non-prescription drugs, so you can just get them over the counter and apply twice a day, and by the grace of God, the infection will be cleared. But for the ones that affect the head region, that is the tinea capitis and the nail, and like I said, they're usually recalcitrant in terms of they are very difficult to clear. So you might have to go or be on the treatment for a long time. Then even when the lesions disappear from your body, you still need to keep on using the drug for some more time, like a period of 1 or 2 more weeks after the lesions visibly disappear, so there won't be a relapse. So with that, I'm gonna end the PowerPoint presentation. I hope we have learned from this presentation. May it be for us and not against us on the day of judgment. Thank you very much for listening. Assalamu alaikum wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh, Doctor. Thank you very much. Jazakumullah khairan jazayikum and jazali awalin. Inshallah, if we have questions, you can write it out in the chat box, or you can as well raise up your hand and we can recognize you to ask your questions. Doctor, if you check the chat box, there's a question there already. There is a question there, and the question is this IFO or what? And I've been referring to the slide. Is the slide IFO or what? I don't know what IFO means anyway.
I think what he meant to say is IFO.
Okay.
Writing Yoruba in English can be quite, challenging.
Yeah.
Yeah.
I also wanted to ask, is it also lakpa?
Exactly. That's what in our local parlance we call lakpa. Yes. So, but it depends on the area it infects. Like I think on the head, that's what mothers majorly call lakpa, if I'm right.
Yes,
exactly.
yes.
Okay. So that is it. Then I'm sure the one that affects the fingernails in our local parlance and our local language, you don't call that lakpa, right?
No.
Yes,
not
but
at all.
it's the same pathogen, it's the same fungi organism that is responsible for everything.
Wow.
So that's why we need to be very careful, especially
what do we do?
Stressing the environment.
What do we do in this situation? Lakpa is rampant. Everybody see lakpa all the time.
Everybody see lakpa all the time, yes. And that is another reason why I brought this slide up. That we just see it as being so common that we still don't look for the source or consider where it came from. If you can see the initial slide, you can see this mice, both the one on the right and on the left, and
yes.
the dog as well. Then we can get it from cats too. These are common things in our household, in our environment. I don't know for you, but in most households, there's no household that you hardly see a rat, maybe once in a while, right?
Yes.
So all of these things, it really matters. Then maybe another reason why, because I've told you about the risks animals pose to us. You can see this is a picture of a cat that has it, a cow and a horse as well. You can see it's not even sparing horses. The one on the right, the image on the right is the image of the horse that has lakpa. So after mentioning this, the animal host, how it can be that is the animals that are spreading this disease to humans, to we humans. I must mention that the human to human transmission too is well established in terms of if you come in close contact with somebody that has dermatophytosis, that is the ringworm infection that we call lakpa, there are chances that you could get it. So that's another reason why it's so common. Then a third reason I would give is that normally what we call natural flora and fauna. Flora and fauna, how do I put it now? Natural microorganisms that stay in our body, right? They inhabit our bodies naturally. That's why they tell females, stop douching, like cleaning your private parts with antibacterial soap and all that every time. Why? Because you're not only killing the ones that you feel are dangerous or harmful to you, you are also getting rid of the natural fauna that is there, the natural microbes that are there. So when you do this, there's nothing, there's no empty space anywhere in life. There's no vacuum. It has to be occupied by something. So when you keep on douching, keep on using antibacterial soap on your private parts to wash it and all that, and you've succeeded in getting rid of the natural fauna, what will happen, flora rather, the natural microbes that are there, what will happen is that opportunistic bacteria, opportunistic microorganisms will then inhabit the place. So with that said, I'll still go back to the issue of lakpa that we are discussing, the ringworm infection. Some of these, pardon?
I said it's very important.
Okay, but I don't know if you heard me clearly because it seems the audio is breaking over here.
I can hear you. I think it's fairly okay now. It's fairly okay.
Okay.
But doctor, what do you think is the remedy aside taking care of our environment?
Yeah, we reduce contact with animals, and after you've done that, if you do come down with the infection, you need to see your healthcare provider. Okay, so basically just reduce any way in which the disease or the infection could be transmitted to you, basically. Then the third reason why I'll give for this ringworm infection being so prevalent, being so common, is that hello, are you talking to me? Okay, that's background noise, right? Okay,
Yes.
background
I muted the person.
Okay, okay. So one of the third reason I will give for it being so prevalent is that these natural microbes, microorganisms that stay on the body, sometimes, and I need to be clear on this, sometimes they get to grow out of proportion. The termatophytes, for instance, the ringworm infection, like I said, is called by fungi. When they like warm and moist environments. So when the environment is warm and moist, sometimes they tend to get out of hand, like grow out of proportion. And as such, they infect parts of the body, and you start exhibiting all of this. You start seeing the signs and the symptoms, all these lesions, patches, and all of that. So that's basically it.
Okay, there's another question here. Someone is asking if after, can all these zoonotic diseases affect us after cooking the animals?
Yeah, because like I said, like I was talking about TB, bovine tuberculosis, I said you should be careful if you go to a restaurant, order for your meal, and you find out that while eating your meat, you hear this sandy sound, it's sandy, like sand, or like granite, rubbing against each other and all that. So even though the meat has been cooked, you could still be a victim of TB infection. So there are some pathogens, of course, that is some germs that are killed by heat, but some others, heat doesn't do all the trick. It may kill part of it, but there are some others that are resilient, that might still, infect humans after it has been processed in terms of cooking, grilling, frying, or whatever. So when you consume those food contaminated with the pathogen, that is the germ, you can still fall ill. But it's best you cook your food very well, because even for food items that don't contain pathogens or any form of germ, it's still advisable that you cook it very well. So the answer is not a one-way thing. It's a yes and a no, depending on the pathogen involved in the case.
Okay, thank you very much, Ma. And I hope we are all satisfied with our answers. And inshallah, as usual, Doctor, kindly help us drop your handle again, your email address. So if anybody is having further questions, they can reach out to you. I'm sure you've given us one time, but you can help us drop it again. So if we have any other...
Sorry, sir. I can see a message here. It's a message sent to my personal wall.
Okay.
My personal chat.
Go ahead.
If I can read it out.
Please go ahead.
Okay. It says, are there preventive vaccines or treatments for zoonosis that might be common in people who work with animals frequently? How strong or well-funded are research efforts to develop these preventive treatments? Oh, wow, this is a long one, and I think it might take us time to answer that in full. But to give a response to this, I will say that yes, there are vaccines and there are treatment options for those who work frequently with animals. For instance, veterinary healthcare professionals and para-professionals that work in the veterinary sector, you can go for things like, for the rabies, for instance. Let me use rabies as an illustration. If you are a student that is going into paraclinical works or into clinical coursework and all that, you can request from the school authorities that you want to get the pre-exposure vaccine. I don't know if I mentioned the post-exposure vaccine for rabies when I was talking. I think I called it post-bite injection. So the thing we call it basically is post-exposure prophylaxis, that is the PEP. But that is after you've been bitten by a dog, in order to prevent the virus from spreading and traveling through your body and finding its way into your brain. That's when you get the PEP, that is the post-exposure vaccine. But for those working constantly with animals, like I said, if you are a medical person in training that has very little experience on protecting yourself or handling animals, or even if you are a breeder, I don't know if some of us or most of us are familiar with breeders. Breeders, as we call them, are those that mate dog. You can take your own female dog to a place or bring your own male dog to a breeder. They mate them. When they mate them, when the female gets pregnant and gives birth to puppies, there's a sharing formula. For males, male puppies are more prized, highly prized than the female puppies. So there's a way you do it. So people do that with breeders. So that's also a very booming sector. But of course, we know as Muslims that is around. We don't breed dogs for profit and all that, but that's by the way. So if you're a breeder, if you are somebody that works closely with animals, you can go for the pre-exposure vaccination. And that contains 5 doses for a period of 14 days. Yes, for a period of, is that it? No, that contains about 3 doses. Yes, for the pre-exposure is the 3. You've got 3 doses, and you get a shot on day 0, another one on day 7, and the next shot will be on day 21. So that's what you can do. Then for the research, like I said, it's a very beautiful question, and but it needs a detailed answer, which I don't think we have time for now. But in answering that part of the question, how strong or how well funded are research efforts to develop these preventive treatments? I would say that it takes a collective effort amongst well-meaning individuals and the government to ensure that this happens, because we find out that it's quite disheartening that some governments are actually cutting back on budgets, educational budgets, budgets meant to fund schools, meant to fund research institutions. They are cutting back on it. It's so devastating to think about it, the aftermath effect, because it seems we don't value the things we should. We lay more importance on things that shouldn't be given such importance, so much importance. Education is key to the development of any nation, but you hear of government spending so much in rehabilitating structures, in quotes, for those who understand what I'm saying, and at the same time, they are cutting back the budget for education and even the healthcare sector. You can see how pathetic the situation is and how bad it can get. But all in all, I pray things improve, and we'll all be better off for it at the end of the day.
Okay, Doctor. On the final notes, we have an additional information, or like an addendum from Dr. Rahima, and it says just an addendum. I'd like to add as ways to reduce transmission. Good personal hygiene is very important. Incubation period for fungi that causes lapa is between 10 to 14 days. Mothers should try to bat their kids on returning from school. Sharing of towels, combs, bed lining for personal infected should be avoided. Mothers should also be aware that lapa cannot be treated with skin ointments. Everybody, our mothers will just be using anything. They should seek medical help for appropriate prescription. Thank you very much, Dr. Remo.
Yeah, in addition to what she said, some even go to the length of scraping the lesion on the child's head. You hear of so many things. Like some will get sandpaper. Like seriously, sandpaper.
Exactly.
For exactly. It, and you see the place bleeding. I think this should stop. We should enlighten ourselves. We should look for means to get ourselves educated. So it's not really the best for us to think that, okay, we can try this, we can try this, we can try that. You are causing more harm than good, and you're causing the child so much pain. And all of this at home practice and all of this, I can do it, I know the cure, I know the remedy, should stop. Please seek the help of the healthcare professional.
Thank you very much, Doctor. I think we should have another session where we are going to be talking about the healthcare professionals themselves. You know, you people you have a lot of energy, you have a lot of power. Everything lies with you medical people. And you know the kind of country we are in Nigeria. So I'll speak with the organizers, the program directors, to help us create a session for just health workers. Let's just discuss our relationship with the health workers and the patients, how we need to grow in Nigeria, particularly the case study of our own Nigeria. So I think it's a very important session we need to talk about, because everything you've been saying, and you've all this while all of you medical practitioners have been saying, go to your health workers, but you know your people now. But till then, anyway, inshallah, we say
Jazakumullah. Yes, I know my people, they are very wonderful people.
Yes, exactly. Very, very wonderful. Thank you very much for this session, Doctor. We really appreciate you. Jazakumullah khairan. On behalf of the academy, we say Jazakumullah khairan, khairan jazai kama jazali awalin. Inshallah, may Allah bless you. May Allah continue to make it greater and greater. Inshallah.
You too. And if I can chip in this, I need to tender my unreserved apology for the break in communication and the delays and all that.
I think we're going to have a short goodwill message before we round up the session. I've just been informed, and once I have the name, I'm going to announce. But on the final notes, we say Jazakumullah khairan again to all our doctors that have been on this session. I don't think this is the end of our health session. We still have one or two more. But I will invite the ES to please give us the goodwill message, inshallah. So ES, you can unmute yourself and give us the goodwill message. Bismillah.
Bismillah ar-Rahman ar-Rahim. Alhamdulillah Rabbil Alameen. We thank Allah subhanahu wa ta'ala for his favor on us. May he continue to be with each and every one of us. To the speaker of today, we thank you. May Allah increase you in all his goodness. May Allah increase you in knowledge, in understanding every good things of life. To each and every one of us, to the listeners, may Allah bless us, protect all our household, protect all our families, and be with us all the time. We thank everybody. We thank you so much. Like we said, that we declared an emergency on health among us because it's very, very important. So important because it's only a healthy person, it's only somebody that is good and sound in health, in mind, that can actually be able to worship his God very well. So there can never be overstatement, or we can't even overemphasize the issue of health talk. And I want to say this, some couple of weeks ago, and I remember we featured a talk that encouraged us to avoid using undue agbo, undue this, undue that. It's important that we don't just listen. We also try as much as possible to act in life, except we want to just make this discussion a precious or a waste of our precious time. I know that the way we are nurtured and our culture plays a whole lot in our life. But we are trying to tell us know that there are some things that we need to start knowing what exactly is the impact it's having on us. So I was discussing with, I know that if somebody tested or if somebody has a particular thing, you need to get a pure test again from the lab to be sure that you are okay. We don't assume. We don't just take agbo and take agbo and take agbo and now assume that everything is going to go. Even if it has gone, you need to even be sure that that same lab that tells you you have this, that demanded you to go and be using an alternative this thing, have even gone back there to even go and test again. So there can be medicine by assumptions, and there can be medicine by presumptions. You can't think that something is going to work and just start using it. So that's one of the critical comments I'm making. I'm saying this because I know it should be said here, that we are saying that it's important we seek medical expertise. Don't jump on a popular, what do you call a popular trip? Seems like everybody is doing it. That's what everybody is doing. That's what everybody is doing. Everybody is having lots of issues. Not everybody will tell you. So our health is very, very important. We pray Allah subhanahu wa ta'ala will be with us and protect each and every one of us. Jazakumullahu khairan, khairan jazaika ma jaza ala wali. You want to have a session with all the doctors? Those people, it's as if you want to have sessions with Buhari and Nigerians. The doctors themselves, they are something else. So, but I hope they are not hearing.
I'm sure they are not hearing this.
Hopefully they are not hearing. So I hope Dr. Rahima is not even hearing and Dr. Aminah. So I will just find a way of. So we pray Allah will assist us that grant us long life and prosperity. Subhanakallah wa nashhadu an la ilaha illa anta wa nastaghfiruka wa natubu ilayk. Subhana rabbika rabbil izzati amma yasifun. Assalamu alaikum wa rahmatullahi wa barakatuh. I like Jami, I'm done.
Now, on this note, we end this session. We say Jazakumullah khairan again to everyone. May Allah assist us. Till next week, we'll be having another session. I want to note where women are also coming up with some programs. We'll send us the links to these programs, inshallah. Jazakumullah khairan.
Okay, please,
everyone.
Before you go, I want to encourage everybody that women's swing participation, it's not just we allow it's only sisters thing and we brothers. I'm talking to the brothers now on the group. We must encourage our wives, our women, to be part of the Women Wings program. Most often than not, we say what? Sure. Okay, most often than not, we just discover that we just make it women's thing alone, and they share this thing on our platform. So our own job as the man is to ask our wives, have you joined the Women's Swing platform? So a lot of initiatives, they are coming up. They are doing quite a lot of things now. The least we can do for them, is to encourage them and ask our own women folks to also join them in when they do their program. So the last program they did talking about widowhood and others, that was a very wonderful program. But the question is that how many of the brothers hearing discuss with their wives that please join this thing? So I'm making this a clear call again to all the brothers, because each time we hear women's swing, a lot of us just close up and see, I want to bring. So beyond that, you as a man, you must ask yourself, where are my own female folks? Your wives, where are they? The women in your house, where are they? They should be part of it. So I'm sorry I have to add this. Thank you. Now.
So on this note, inshallah, we'll send all the details of the programs of, okay. Bora, I don't know if you want to announce it. I can see you saying something here. Okay, it's on the 19th of July 2020, and it's the A to Z of shrouding, the A to Z of shrouding a dead body on the 19th of July, inshallah. So let's prepare for that event. It's going to be live on Zoom as well, inshallah. May Allah make it easy for us. And for those of us that need the email address of our doctor, please don't forget to check your chat box. It's there, a.yusuf4107@student.tsu.edu. So if you need to reach out to our doctor, that's the email address you can use. Our lecturer for this Women's Wing program is Hajia Saidat Daramola. Hajia Saidat Daramola, Abdullah, I guess, inshallah. So may Allah make it easy for every one of us. So may Allah assist us, inshallah. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت ونستغفرك ونتوب إليك سبحان ربك رب العزة عما يصفون والسلام على المرسلين والحمد لله رب العالمين صلوا على رسول الكريم صلى الله عليه وسلم السلام عليكم ورحمة الله وبركاته.